let's discuss the thrombocytes, also known as platelets. Before we talk about them, I'm just going to draw a real quick picture up at the top. This is, again, is my little example of a vein or an artery, right? It has little red blood cells in it. I guess in this case it's going to flow this direction. I'll even throw a white blood cell or two in here, right? So the point is, we have ourselves a blood vessel, right? Let's discuss why this is important. So, platelets, they're really small, all right? Significantly smaller than red blood cells, too, as you can see in this picture. They are non-nucleated, and they form from the pinching off of cytoplasm off of megakaryocytes. So in other words, they're little pieces of cells. So like I said in an earlier unit, they're thrombocytes, they're clotting cells, but they're basically just little pieces of cells that are used to clot. That said, what do? In your normal tissues, just a normal day, everything's going according to plan, no injuries. Their job is to plug up any defects in the walls of small blood vessels. So, going back to my picture up top, let's say right here, or maybe right here, we have some defects. Maybe it's starting to break down a little bit, maybe it's getting a little bit weaker. The point is, the integrity of the blood vessel is weak. So, what's going to happen? These platelets are going to come in and fix those areas. So, I'm making them a little bit thicker so you can see clearly where they were fixed. So, super important. What else are they used for? Injured tissues. So, now let's say there's an injury. Let's say I have a cut. So, let's say right here, I cut my blood vessel. Right? So, if this happens, now I can start bleeding. That's not good. Right? So, number one, we are going to want to plug this up. So I'll do this in blue or purple so you can clearly see. They're not purple, but I'm just showing you to make it easier to see. What's going to happen is these little thrombocytes are going to come into the area and they are going to clot the hole. This way blood can no longer leak out. So again, they're clotting. They don't want to clot too much. You don't want to clot this whole area, right? You don't want to clot it and then therefore no more blood can travel, right? But you want to clot it enough to make sure that there's no bleeding. Another really important factor is serotonin. So platelets are going to release serotonin, which are going to constrict the blood vessel. So going back to my picture. So if I were to fix this again, what we're going to see this time is, here's my normal blood vessel. If I want to constrict this, what's going to happen is we're going to see these blood vessels get smaller. The reason for this is to reduce the amount of blood that's flowing through the area, right? So why do we want to do this? This is important because, again, if there's a leak somewhere, if there's a really big blood vessel opening where you're bleeding a lot, you want to constrict the flow. So think of it like if you have a hose and your hose is running and it just keeps going, but you want to stop it from from spraying water everywhere. You can either turn off the hose, but if you're too far away from the spout where you turn it off, you can just take the hose and you can squeeze it. If you squeeze it, now water can't escape, and that's essentially what's happening here. So, what causes the constriction? One more time, the hormone serotonin, which is released by the platelets when they're doing their jobs. So, platelets, really important for blood clotting. And if you have any questions on this, please let me know.